study of our earlier assignment that WHO entrusted us in 2006 and 2007, when we were asked to look into the national data in various states of India in the matter of water supply and sanitation coverage, and to correlate it with the health data of disease burden, and to see what has been the impact of the investment made in water supply and sanitation sector in reducing disease burden. I must admit that the assignment did produce a very conclusive result, because the correlation coefficient between sanitation coverage and the burden of infectious diseases related to water and sanitation was not very significantly, conclusively established. As a result, this follow-up study was suggested by WHO in consultation with us, that because you see the basic drawback in the earlier desktop study was possibly the confounding factors like inadequacy of the secondary health statistics, inadequacies in the coverage of water supply and sanitation data, many collateral socio-economic developmental factors, and also the very significant factor was the absence of any dependable data about the level of hygiene perception and behavior and practice in the community. So we thought to do a pilot survey to map the level of awareness and perception of public health and hygiene issues in the community, particularly the women who were in the family manager, and impact of the same on hygiene practices, to assess the health impact of hygiene perceptions and practices, and to assess the linkage between the availability of sanitation facilities and the status of hygiene and health. And in this regard, I would like to say that we particularly draw attention to the nirmal-grams. I don't know whether you are aware of the concept of nirmal-grams in India. I mean, for the last few years, government of India is awarding the villages which are 100% sanitation covered, and with the award of nirmal-gram. So it was hygiene, safe storage and handling of drinking water, home and food sanitation. Next one. Safe disposal of human excreta, safe disposal of solid waste, safe disposal of liquid waste, and general sanitation in the community. For each of these key issues, there are again a number of sub-issues. And then after assessing the level of perception and practice on all these issues through interviewing with the questionnaires, we were comparing and correlating it with the disease burden. And disease burden was assessed, incidence of disease, general sanitation in the community. You will find that practice lacked the perception. But it is quite expected, because these issues, variables, were not controlled by the household managers. They were more or less community, institution, and municipal or local body control. Next one. And if we look into the consistency between perception and practice of hygiene, you will find that while safe disposal of solid waste, both in most of the communities that we looked into, various ethnic and religious and socio-economic groups, that disposal was low in perception as well as practice. Whereas safe storage of handling of drinking water and safe disposal of human excreta did show high perception and practice. The reason is that these two issues have been long established, traditionally established, anchored in the community, and also during the last 5 years or so, decade, the governments like Bangladesh, India, the sanitation, there is a strong total sanitation but it is not so pronounced. Next. And you can see, this is interesting, I must say, that with the sanitation coverage, you see the hygiene practice improves. Both awareness and personal hygiene scores improves with sanitation practice. And both of them also has very positive influence on reducing the disease burden. Here a question remains. A question remains that which is influencing which one? That is it? Because there have been many other studies also in Zimbabwe and other places which has shown that a better hygiene behavior improves the demand for sanitation and that increases the coverage of sanitation. And on the other hand, you can say that a sanitation coverage, particularly in India, we have noted that total sanitation campaign is always accompanied by an intense campaign for hygiene behavior. So when we go for increasing sanitation coverage, we are also improving the hygiene behavior of the community. So I think that question remains a little unresolved, that whether hygiene attracts better sanitation coverage or better sanitation coverage improves hygiene behavior. But the fact is established that hygiene behavior and sanitation coverage, that is the hardware and software, should go hand in hand. It is observed that on issues like personal and home hygiene, where home managers are responsible for converting perception into practice, perception and practice level are close. But this is not so on issues like solid and liquid waste disposal, where institutional and community managers plays a more critical and key factor. Perception and practice of hygiene play a critical role in reducing burden of communicable diseases in the community. Provision of household toilets for safe and sanitary disposal of human excreta has a strong negative correlation with the burden of communicable diseases in the community when executed with adequate awareness campaign on public health and hygiene issues. The study findings very emphatically indicate that to optimize health benefits from community water supply and sanitation, the hygiene behavior issues should be integrated with the programs undertaken by the national government for provision of water supply and sanitation hardware in the developing countries. The perception of the community, particularly the women, regarding the public health and hygiene issues is an important